Hello, my name is Amy9, and I will be introducing our T5 video pitch topic. Our topic is Rise in Heart Failure Mortality, led by U.S. citizens age 45 and under. Recent data in cardiovascular mortality is showing the reversal of heart failure-related deaths in younger populations. Between 1999 and 2021, the death rate spiked to at least 906% increase for those aged 45 and under. According to cardiologists around the country, premature coronary disease is being seen in those in their 30s and 40s, which would have been unheard of 20 years ago.
Public health focuses on three core areas: assessment, policy development, and assurance, working through state, local, and federal agencies to improve population health. Obesity and heart failure are significantly influenced by socioeconomic factors like education, income, race, and neighborhood environments. For instance, living in poorer areas can limit access to nutritious foods and exercise, increasing heart disease risk. Policies like the Affordable Care Act have addressed these issues by expanding Medicaid and eliminating spending caps, allowing more people to access necessary treatments. States adopting Medicaid expansion have significantly lowered uninsured rates, benefiting those with obesity and heart conditions. Geography also impacts care, as rural residents face challenges accessing healthcare facilities. Government branches play vital roles. A recommendation that I have is for the legislative branch to build a coalition addressing obesity and heart failure. The legislative branch can create and change laws. These laws can make healthcare more accessible and affordable, while the executive branch can put these laws into practice. Targeted policies can reduce cost, improve accessibility, and enhance care for those at risk.
When analyzing the rise in heart failure mortality for people under the age of 45, it is important to utilize the social ecological model to understand the interplay of factors that lead to disease and poor health. These factors include individual, relationship, community, and societal factors. Individual factors such as age, race, income, and behaviors can help explain why racial minorities have the highest rate of heart failure. According to the U.S. Department of Health and Human Services, non-Hispanic Black Americans are 70% less likely than non-Hispanic white Americans to have health insurance. This creates a barrier to access of care. Relationship factors can also play a role. Familiar roles of guardians, completing the grocery shopping, and food preparation can lead to decreased access to healthy food for minors, which in turn increases the risk of heart failure. Community factors also help play a role in the increase in mortality. Lack of access to safe environments prevents the public from partaking in heart-healthy exercise. Lack of exercise has been known to increase the risk of heart failure. There are also societal factors. In fact, focusing on delivery of care and education on proper use of heart medications could decrease mortality rates that are due to heart failure to 50% of their current rate. Therefore, it is important to provide an intervention that is a multi-level solution instead of one that just focuses on one level of the social ecological model. Encouraging a community to get involved by educating the general public on the importance of advocating for access to parks, grocery stores, and healthcare is the best way to decrease the mortality rates of U.S. citizens under the age of 45 facing heart failure. One way to do this is through social media posts that highlight the links between all of these factors and the increased risk of heart failure to allow individuals to analyze their own risks and determine what they need and want to see changed.
Hi, my name is Sydney, and I will be talking about the next area of public health as it pertains to heart failure mortality, which is biostatistics. Biostatistics is an important subsection of statistics that deals with health science data collection, organization, analysis, and interpretation. The use of biostatistics is essential in assessing the reversal of heart failure-related deaths in younger populations. For instance, according to the Journal of Cardiac Failure, approximately 6.7 million Americans over 20 years of age have heart failure, and the prevalence is expected to rise to 8.5 million Americans by 2030. Biostatistics clearly illustrates the escalating nature of heart failure in younger populations. To help solve this issue, biostatistics could be used to analyze datasets of heart failure mortality, identify risk factors of heart failure, predict coronary disease progression, and evaluate treatment strategies.
So, epidemiology is the study of the distribution of diseases, origins and risk factors of diseases, and methods to control the spread of diseases. And this is important to our topic to analyze the underlying causes and risk factors for heart failure in young populations, which includes ages 45 and under. And then once we understand these risk factors, we can use them in intervention to target them to decrease heart failure. So risk factors for heart failure in all populations include age and sex, hypertension, diabetes, smoking, and previous myocardial infarction. But in young populations, diabetes, smoking, and previous myocardial infarction are the most prevalent. And young populations are at a threefold higher risk for heart failure if they have hypertension than older populations. And once we understand these modifiable risk factors, including diabetes, smoking, and hypertension, we can target them in public health intervention to reduce the incidence, which is the number of new cases of heart failure in young populations.
Hello, my name is Amy Nine, and I'll be introducing the environmental health sciences sector of public health. One way to look at environmental health sciences in public health is through an approach called One Health. One Health addresses health outcomes in individuals through understanding the relationship of the environment, personal lifestyle, animal health, and even advancements in medicine. In our case of rising heart failure in those under 45, it's critical that we focus on how our environment plays a role in this trend. We have some modern examples like buildings nowadays relying on elevators and escalators, reducing opportunities for incidental exercise, which discourages individuals from partaking in daily exercise. We have the interplay of urban and rural environments, which shows us the difference in how our environment shapes our level of care. For example, urban environments often promote more sedentary lifestyles while also exposing individuals to higher levels of air pollution. In rural environments, many do not have easy access to healthcare facilities, which may delay important checkups on cardiovascular health. Finally, the stereotype of the American diet highlights the unhealthy choices we make in terms of our food. For example, when you think of the American diet, you think of heavy burgers, fast food, and other things of that nature. In a study comparing the American diet to a Mediterranean diet, we saw that both populations consumed the same level of fat. However, heart failure rates and cardiovascular health overall was wildly different. This is because in the Mediterranean diet, they consume a lot more healthy fats. This means diets of fatty fish, fruits, legumes, and nuts, which drastically is different compared to our processed and meat-heavy dishes. Finally, addressing these cultural and environmental factors is key to reversing rising heart failure rates in younger populations by promoting healthier lifestyles and proactive habits.
We have chosen to create an educational social media campaign to spread awareness about the link between obesity and heart failure. Using platforms like Instagram and Facebook, we'll reach younger audiences with engaging graphics that emphasize preventative measures, such as healthy eating and regular physical activity, highlighting insights from cardiology experts and advocating for expanded healthcare coverage through the Affordable Care Act will address challenges that limit access to effective heart care. By partnering with the community organizations, we'll push for better access to fresh, affordable food, urban spaces that promote physical activity, and reduce pollution to support healthier lives for all.